On the 11th of March 2020, the World Health Organization declared COVID-19 a pandemic. This came after a drastic loss of life and many countries having to take drastic measures such as total lockdowns, which affected many people's livelihoods across the globe. Globally, the number of COVID-19 infections are now over 150 million, and the world as of today has recorded an estimate of 4 million deaths. Zimbabwe announced its first COVID-19 case on the 20th of March, and since then, the number of infections started to rise. As COVID-19 hit Zimbabwe, hotspots were mainly in major cities, that is Harare and Bulawayo. Zimbabwe has been hit by two COVID-19 variants, that is the South African variant and the Delta variant. Approximately 80% of the fresh COVID-19 cases in the country were of the Delta variant. The Delta variant, which originated in India, has been described as one of the most virulent that killed over 4,000 people daily in the Asian country. Most common symptoms include fever, dry cough, tiredness, and less common symptoms include aches and pains, sore throat, diarrhea, conjunctivitis, headache, a loss of taste or smell, skin rash, or discoloration of fingers or toes. Now, there are serious symptoms, which is difficulty of breathing or shortness of breath, chest pain or pressure, loss of speech or movement. So what are the next steps when you get infected? Seek immediate medical attention if you have any of these symptoms. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, if after 5 to 6 days you still are not feeling any symptoms, you're not out the woods yet, because it actually can take up to 14 days for those symptoms to show. You are supposed to stay at home. And if you have a room you can use for yourself, ideally, you should sleep alone. And if possible, allow no one entry into your room. However, if you have someone taking care of you while you self-isolate, ensure you also prioritize their safety. You may need to have your own bathroom and toilet, but if you're sharing, you may need to use the facilities after everyone has. Make sure you disinfect those facilities. Do not share plates, cups, cutlery, and those should be cleaned and disinfected appropriately if they are. Zimbabwe has embarked in a vaccination program where it saw both public and private sector join hands to procure COVID-19 vaccines. The country has a population of about 15 million and has since received 4.2 million vaccines, while another 2 million doses have been delivered since early July. The country is targeting 100,000 daily vaccinations to achieve herd immunity by the end of the year. Zimbabweans have taken time to get vaccinated, regardless of the number of conspiracy theories which are against vaccinations. Now, there are many conspiracy theories surrounding COVID-19 vaccinations, and this has given people an element of fear on whether to take up the vaccine or not. Vaccinations are open to all Zimbabweans, although frontline workers are still being prioritized. Vaccinations remain voluntary, and those who wish to get vaccinated can visit municipal clinics and public or central hospitals. Even though the government has taken measures to get the Zimbabwean population vaccinated, the country is not yet out of danger. The vaccines will complement existing prevention and control measures and not replace them. COVID-19 regulations and protocols are still being emphasized to avoid infections. Members of the public are still encouraged to maintain social distance, sanitize, avoid social gatherings or any gatherings for that matter, and wearing of masks is still mandatory. Don't hang your mask yet. The fight is still on.